I'm Ellen. I know most of you. I don't know. We're going to be talking about wound care and wound dressings and different things that we have that we can use to help prevent any pressure injuries. We're very big on that. We have a nice program going on our floor that has actually been used now on other floors as well. But there's newer products, so we'd like to go over all the new products and then talk about some of the stuff that we have. And it's always a good reminder, okay? A pressure injury can cost upwards of $25,000 for a patient. So, you know, when you come in and the person already has a pressure injury, you know, it's devastating. People can get septic, they can die from having pressure injury, okay? So what we want to do is make sure that we're preventing that. People are sitting in the beds for a long period of time. They're sitting in their wheelchairs for a long period of time. Sometimes they come to us and they've already been in the hospital for weeks, okay, and they've been in bed. So we want to make sure we're getting them up, but what are we doing to help prevent any kind of pressure injury or any other kind of skin problems, okay? So unfortunately, Irene was here this morning. She's our wound nurse practitioner, but I'm going to give it a go. I do love wound care, so always, everyone has nice posters. I always have the worst pictures, but it's okay. And everyone, no one wants to talk about wound care, but it's so, so important. Okay. So there's different things, and I'm not sure if everyone has heard about some of it. I mean, sometimes you hear the buzz MASD, which is moisture associated skin damage. A person who's incontinent, whether it's bowel or bladder, you know, it's very important. We got to keep these people dry, because if they're wet, their skin gets wet. If you guys sat in the bathtub long enough or a swimming pool and you come out and your skin is all macerated, it's like white. You know, what happens is as you start drying that off, your top layers of skin start coming off. So imagine that this person has a diaper on. It's now a moist, wet environment. You start wiping them, especially in their peri area, and the skin starts coming off, okay? So what was just wet skin can now actually be an opening. Openings can cause infection. Infection can cause sepsis. It just goes on. And what might be like a small little hole, but then becomes like a big problem, okay? So we do have a lot of different things that we use, and I'm sure Carolina can actually chime in on this as well. We do have a cleanse, which if you are cleaning somebody, if they've had a bowel accident, really a good product. Sometimes good old soap and water, also perfect. You know, you don't necessarily have to scrub because you want to be careful of their skin, okay? But this is actually a really good product. You can spray it on. You can spray it onto those nice wipes that Nadine just had and help clean it up, okay? We do have barrier creams. We have them on the floor. You might see like 4 tubes of this next to the person. If you make sure though you check their drawer or their basin before you go to Parex to get another one of these, because we don't want to waste, okay? These products actually have in them zinc oxide, so they're white. They kind of get really on you. So put a nice smear on the person if they already, and it actually causes like a nice barrier to keep their skin dry, and also keeps the moisture barrier out, okay? So this one is our protectant. This one is also a protectant cream. So if you don't see the orange cap, the blue cap is also really good.
Those are CHG friendly as well.
Oh, very good. CHG friendly.
Yeah. Don't want to take that off.
Oh, yeah. One of our new ones is the Triad cream. Okay, this is a newer product. Also used as actually a dressing instead of putting a dressing over it. It actually forms a bond over the wound. Cavalon, we use Cavalon a lot. I don't know if anyone was an athlete, but if you ever use the Tough, the new skin, the Tough one before they put pre-wrap on you, this stuff super really good. So when the people come in and their heels are getting a little bit boggy from sitting and laying in the bed, they use the Cavalon spray a lot of times too. It helps toughen the skin up. Okay, so but with that being said, You know, heels are always on the bed. What's always on the bed when you're laying down? Back of the head, scapula. Some of these people are super thin, so their spinous processes, if they have any kind of abnormality, you know, that could actually, whatever the bony prominence. So if you're laying on your back, your sacrum, your heels, anything that's a bony prominence can actually, you know, if you sit for longer than a half an hour and you're not adjusting yourself, you can actually get skin breakdown. So what do? We say, okay, well, we're going to put them on their side. And we have wedges. These come as a pair. We put one above and one below. So if we want to keep them off their buttocks, we actually put one kind of up here, and then we put one a little bit further down so that there's actually air able to get in and they're not literally laying on that pressure area. So a lot of the times they'll come in and they'll have sacral sores. So we want them to be on their side. However, just think about it, they're on their side. So now your pressure areas have changed. Now you have your shoulder. You also have your greater trochanter. You have the side of your knees. And when you're sitting like that and you're laying on your side, now knee to knee contact is bone to bone contact. Your heels and your ankles, I'm sorry, those also are bone to bone. So it helps to have a pillow between. This is when you start seeing a person have like 5 pillows on their bed. Okay, so you want a pillow between their legs so that the bone to bone contact isn't causing pressure or injury here, and also down at their feet and their ankles. Okay. When they're in bed, you'll see a lot of times there might be pillows so that their feet are hanging and their heels are not touching down. We don't want pressure on their heels. Whenever you put a person up into at least 30 degrees at the head of the bed, elevated, puts pressure onto their sacrum, okay? Puts their sacrum at risk. That's how people love sitting in their hospital bed. They love being up a little bit, watching television, maybe eating like that. They're starting to slide down in the bed. What they're doing is they're shearing their skin on their sacrum. And these people are really bony. And even if you're not bony, the pressure can cause a breakdown on their sacrum because it's very bony. So make sure that we're changing positions, rolling them during the night. They roll them, you know, they roll them side to side every 2 hours. If they're high risk, every hour. They'll have like a little check off in their room. Okay, so the wedges are excellent. These are our new ones. These are our True Views. Okay, if you actually open this up, when you put it all together, so nice. I just don't want to use it, but you'll see that there's a little hole. So back in the day, and actually we still use them, is the multi-POTUS boots. They have the rubber on the bottom, the blue ones. Everyone's like, oh, the blue boots. The person can actually stand with the blue boots on because it does have rubber on the bottom. So if we have to, we have them use that. These are really, really great. These are new, the newer product for us in the past year. They do have little kickstands so that the person's leg doesn't roll out. It can keep it, you can put the little kickstand on this side, or if you flip them over, you can move the little kickstand on it. They're Velcro. The nice thing about this is you can pick their leg up and you can check their heel while they still have their boot on. You don't have to take the whole entire thing off just to examine it. So literally the true view for you is that you guys can actually check their skin on their heels while they have this on. If for some reason they have any kind of moisture, if their wound is actually draining or bleeding, these are really nice. It's wipeable. They go home with them. They're actually, you can pop them in the washing machine. So these are really nice for the patients, and we've had really good success with these. So you'll see these quite often. The other new thing that we have that, you know, and Julia and I had talked about this, is InterDry. And, you know, it's a newer product. Also, we got it about last year, but it's been out on the market. We just started actually putting it in our car right now in the past year, but it's a great product. It feels like actually a piece of cloth. It's super comfortable, but it has silver in it. So you have those people who may be obese, or they have a lot of, not necessarily drainage, but they're sweating. Okay, so we all know what we're talking about. The patients who then have areas underneath their breast, could be underneath their abdomen, their folds, where they definitely, as they're sweating, they're getting a lot of breakdown. and a lot of like, almost like a fungal rash. This stuff is really, really good. So the piece comes, this piece comes super big, okay? But if you notice, if you saw it up close, there's little dots on it. So you can actually cut this and use pieces, okay? You want it to hang like an inch below what you need. So say this was gonna be under the person's breast, you'd lift up the breast, you cut off the piece, and then you would have it hanging down. And what happens is the fluid or sweat will actually be absorbed in here and actually run towards the bottom, so it gets away from the area. Really, really good because it has silver in it. It actually helps cut down on fungal infections. So really great product. Hopefully we'll start using a little bit more for different things. For my shoulder surgery, I put it underneath my armpit because I was in a sling for 8 weeks. It was marvelous because you're sweating and it actually takes the sweat away from that area, and I wasn't allowed to lift my arm. So I can tell you for a fact that it works really, really well. So those are just a few of the products. You know, Irene actually can speak more to all the different bandages and things like that. But as far as this goes today, just remember pressure with your patients, relieving pressure and getting them off their hiney, probably the best thing. And as therapists and as healthcare professionals, really you need to, we have so many different products. We have boho cushions and things like that. So if a patient has a pressure injury or anything like that, seating systems, how we're transferring them, are we using a sliding board? Are we shearing them across the bed when we're moving them? Things like that. You always just have to be careful about, think about the patient's skin whenever you're moving them around, okay? And just remember, we all play a big part of that. And as well, on our floor, we started doing 4-eye check. So as a patient comes into us, the nurse, 2 nurses actually, so it's 4 eyes, will check a patient and evaluate them from head to toe and check and see what they have as they come in, okay? So we want to make sure that everyone's seeing the same thing. And I can honestly tell you, and it's been almost 300 days on our floor since we have had a pressure injury that has happened, a hospital-acquired pressure injury on our floor. So kudos.
The middle of January.
Yeah, so we're doing, knock on wood, we're doing super great with that. So, but that is a interdisciplinary process that has been really, really working really well. So if you see something, say something, okay? Thanks, guys.